for it. Parents of addicts have begged for it, and now law enforcement will have greater access to a life-saving drug.
Yeah, Narcan can take a person who overdoses from heroin from the edge of death right back to life in moments.
Matt Markham details the plan which would get the drug in the hands of all police officers across New York State.
It takes a few minutes to learn how to use, but it can save a life in seconds. Naloxone, or Narcan, is the next tool law enforcement will use to fight a problem in your community.
It's pretty instantaneous. When you administer it, the person immediately goes into drug withdrawal. So you get somebody who is on the point of death, and then it's like they come back to life.
Officers recognize that the number of calls for heroin and other opioid overdoses is ever increasing. The Department of Criminal Justice Services, along with the Department of Health and the Office of Alcoholism and Substance Abuse Services, trained 260 officers on how to use the nasal spray.
Our goal is to make sure that every police officer in the state who wants to have this drug and wants to have this training has it.
The state police wants Narcan in every cruiser, since many times, in rural areas especially, police officers are the first to arrive for an emergency call.
We also have been carrying the AEDs for a period of time now. So we've really, even though our primary role, people think, is in preventing and enforcing the law, preventing crime, enforcing the law, part of our responsibility is serving the public.
Those police departments whose officers attend training leave with Narcan at no cost, Glenville and Cambridge among them.
There's over 500 police departments around the state, and they're everything from very small departments to very large departments. And in one way or another, we'll work with them. We figure at a minimum you're talking somewhere in the neighborhood of 15,000 to 20,000 police officers.
If we save one life, it's worth the whole program.
Matt Markham, CBS 6 News, Albany.